We will outline in this short video how you can support recruitment to the PPiP2 study in your trust. Our aim is to identify patients in mental health trusts across the UK whose psychosis may be linked to a number of pathogenic antibodies. The study involves the collection of blood samples and the use of live cell-based assays to investigate the presence of NMDA, LGI1, GABA-A and Caspar-2 antineuronal membrane antibodies. Antibody-positive participants might then be eligible for the SYNAPSE-2 trial investigating immunotherapy for this subpopulation of psychosis patients. We will explain all details of the recruitment process, who is eligible for the study, how informed consent is obtained, and how to safely send the blood sample to us. Anyone with acute psychosis symptoms should be considered for these antibody tests. However, to be eligible for the study, they must be aged between 16 and 60, and their current episodes should be less than 2 years. We can include first episode and recurring psychosis patients. However, if they have a history of psychosis, there must be a period of at least 6 months remission prior to their current episode. We cannot include anyone who is pregnant or has a coexisting neurological condition, such as multiple sclerosis, epilepsy, or brain injury. If in doubt, please feel free to contact a member of the study team to discuss. We define acute psychosis for the purposes of this study as having at least one of the following symptoms at a moderate to severe level. Ideally, patients should be recruited as soon after admission as possible. Please note patients do not require a primary diagnosis of psychosis or schizophrenia, and patients experiencing mania or depression should also be considered if they're experiencing any of these symptoms. We will send you a localised version of the participant information sheet in your trust. Please offer this to eligible patients and briefly explain the study. When assessing capacity, please note that capacity to consent to this research study may be different to their capacity to consent to treatment, and even patients under section may have capacity for the decision. If they are deemed to lack capacity, you should then approach a personal consultee and provide them with the consultee information sheet. This may be a relative or partner, or where there is no one appropriate, a clinician involved in the patient's care who is independent from this research study could act as a professional consultee. Consent must be obtained by someone with NIHR Good Clinical Practice training, and therefore you should ask the patient or consultee for permission to pass their contact details to the research team. This might be an identified person in your local research team or a member of our central study team, depending on what has been agreed at your site. Details of the patient, including their date of birth and NHS number, should then be sent to the research team along with contact details for the individual or for their consultee if they're lacking capacity. Consent can be obtained remotely over the phone by a researcher, who will then contact you to let you know when the consent has been obtained and the blood sample can be collected. Please let us know if you're interested in completing the GCP training in order to consent patients for the study. The blood sample should be collected as soon as possible after consent has been obtained. Blood kits can be ordered from the study team free of charge, which contain a blood tube and a £10 voucher for the participant. Please give this to them as a thank you for taking part. There is also a sample card to fill in the time and date that the sample was collected. Each blood kit has a unique ID number which will be on the blood tube and the sample card. There is no need to write patient identifiable data on the card or on the tube, as we only need this study ID. Please remember to make a note of it before sealing the kit. The sample, once collected, should be placed in the silver pouch provided and finally put into the clear plastic bag. The box will seal shut once a white piece of card is removed from the lid, and then the postage sticker can be unpeeled and wrapped over the top. This can then be placed in your outgoing post at your place of work or put into any post box. After taking the sample, please email the person who obtained consent with the study ID number used and the date that the sample was sent. We will send you a copy of the completed consent form to give to the participant. You'll be notified of the blood test result within 7 to 10 days, which can then be noted in the patient's medical record. To summarise the process, please approach eligible patients to discuss the study and email their contact details to the research team who will obtain consent. Take the blood sample using the blue blood kit provided and give the participant the £10 voucher. Send the sealed kit in any post box, and finally email the research team to confirm bloods have been sent and which ID number was used. Thank you so much for your help with the PPiP2 study. Please don't hesitate to contact a member of the central study team with any questions.